The trend of childhood obesity was first reported in 2008 by a study conducted by St. George's University. Some of the contributing factors back then that were identified were the role of price and availability of both healthy and junk food, the lack of community engagement, and relevant communication deficiencies that existed about proper eating habits. Today, the team at the council visited the Riverview Daycare. There, children's height and weight were calculated. Communications and Research Officer at the Grenada Food and Nutrition Council, Lichelle Murray, says the aim of the visit is to promote the nutritional health and well-being of all sectors of the population.
We have scheduled 11 government daycares and 35 private daycares. This will also be done in Carriacou. And we're basically our nutrition officers who work in the different parishes. They go into the various daycares and we're measuring the weight and the height of the children at the daycare. So that's children 6 months to 3 years old.
A view that acting supervisor of the daycare, Natalie Hilaire, agrees with. However, she emphasizes that parents need to play a more responsible role, as what's easiest is not always the healthiest option.
More healthy eating habits, less junk foods, because we know sometimes parents find it more easier to pick up a box drink or the snack that we don't really promote, for good nutrition of children. So I think in that area, it needs to improve a little more.
However, amidst those goals, there is a much bigger concern, that of obesity among children. Anne Wilson, Nutrition Officer for St. George's, says they have already visited close to 12 centers, and the figures are worrying.
And this has been a trend for the last few years, that we have been seeing an increase in obese, overweight children among daycare 6 months to 3 years. And this year is no different. We still are seeing a few children who are overweight or obese.
What will be your recommendation to us?
We are advising parents that the juices, the box juices, quite a lot of box juices come to daycare, and these box juices have a lot of sugar. And children under 2 years, WHO recommend that they should not have any added sugar to the diet. And these box juices have quite a lot of sugar. Some of the breakfasts are very large too, so we want to see smaller breakfasts with fruits included and less sugar and box juices.
The study is being conducted throughout the months of November and December. The information collected will be shared with daycare supervisors and parents of children with whom obesity and other concerns exist, and will work along with the GFNC on possible solutions. Eugenia Peters, GBN News.